Hello. Good morning, ma'am.
Good morning.
Ma'am, is it audible, ma'am?
Yeah. Am I audible?
Yes, ma'am.
Madam, is it audible?
Yes, sir, it is audible. Am I audible?
Yes, madam. Shall we start, madam? Shall we start?
Yes, sir, sure.
Good morning to all the participants. Welcome to this webinar, national webinar on Panchakarma. Today we have a special guest, Dr. Deepti Bagewadi madam, who is working as Associate Professor in Department of Panchakarma, KLE BMK Ayurved Mahavidyalaya, Belgaum, Karnataka. So we welcome you, madam, for this webinar.
Thank you, sir.
Madam, we want to know from you whether this basics of electrotherapy, whether this electrotherapy method we can give it independently to the patient as a therapy or supportive therapy to other diseases or other medications. And we want to know from you, madam, in which practical diseases this electrotherapy can be implemented. All these views we want to know from you, madam. And I want to inform to all the participants that this session is live on Zoom as well as YouTube. The recorded version is also available. And lastly, I want to tell all the participants that especially for the PGs, we are issuing the e-certificates. So please contact Dr. Divya Jyoti. We are keeping the mobile number in the chat box. So please register your names and please any queries if you are having, we will discuss with our special guest today at the end of the session. So thank you, madam. Once again, I welcome you for this webinar series. Thank you, madam. Thank you. So I give to the Dr. Radha for the brief introduction of our chief guest today.
Namaste, ma'am. Good morning to all. Myself, Dr. Radha from first year PG, Panchakarma department. It's my pleasure to introduce today's eminent speaker, Dr. Deepti Bagewadi ma'am. Presently, ma'am working as Associate Professor of Panchakarma in Sri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgaum. Ma'am completed Bachelor of Physiotherapy in KLE Institute of Physiotherapy, Belgaum in the year of 2007. Ma'am completed Master of Physiotherapy in KLE University, Belgaum in the year of 2009. Ma'am has a 10 years of experience in the Department of Panchakarma, KLE Sri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgaum. Ma'am has undergraduation teaching experience of 10 years and post-graduation teaching experience of 7 years. Ma'am has published many research work. Some among them are Neurological International Battery as a predictor in low birth weight infants and liniment musculoskeletal disorders and pediatric physiotherapy and effect of integrated approach in the management of sports injury. Work on Janubasti and physiotherapy in osteoarthritis of knee joint. Effect of Katibasti and physiotherapy in sciatica and effect of Upanaha and physiotherapy in osteoarthritis. Effect of myofascial release and Patrapinda Sveda in neck pain. We have honor to have you, ma'am. Thank you, ma'am. Today, ma'am is going to deal with the basics of electric therapy. Before we start the session, some instruction to the participants. Uh, Please mute your audio and video while joining the webinar. And if you have any queries, put in the chat box. If there is any disturbance in the connection, please wait patiently until the resume network. Thank you, ma'am. I request you, ma'am, proceed the session. Hello. Hello. Ma'am. Hello. Ma'am, is it audible, ma'am? Hello.
Hello.
Wait. Hello.
Hello. Hello, ma'am. Is it audible, ma'am?
Yes, yes. Am I audible?
Start the session, ma'am.
Yeah, I'll just share the PPT.
Yes. Yes, ma'am.
Share screen. You can share your
You can share your screen, ma'am. Now.
Is it shared?
It's not.
You can share.
Shall I?
Okay, madam. Fine.
Is it shared?
Sure, you can start, madam. Please, madam. Thank you.
Yes. Thank you, sir. Am I audible?
Yes, ma'am. Is it audible, ma'am?
You can see the PPT?
Yes, ma'am.
Okay. Shall I start?
Yes, ma'am. Yes, ma'am.
Okay, thank you. Thank you, Dr. Pooja, for the introduction. I would also like to thank Dr. K.C. Das, Principal of SVM Ayurvedic College, for giving me this opportunity. And I heartily thank Dr. Badrinath, sir, Organizing Chairman, for giving me this opportunity to share my knowledge with you all. And I would like to thank my dear student, Dr. Supriya Bhosle, for giving me, considering me in this webinar. Thank you, sir. Thank you all. I'll just start with the PPT. Now, as Dr. Badrinath sir asked me to tell about the electrotherapy and how it can be inculcated in the daily practice in different conditions, I'll just start with what physiotherapy is, because this talk is for the UGs and the PGs. So I thought I'll just start with what physiotherapy is, and then how we will deal with further what treatments can be given, and how, according to which conditions we have to treat them. Am I audible?
Yes, ma'am. Audible, ma'am.
Can I continue?
Ma'am.
Yes. Thank you. Okay, coming to the introduction of physiotherapy. Physiotherapy is a healthcare profession concerned with human function and movements and maximizing the physical potential. So like any other healthcare profession, like we have modern medical science or Ayurveda or homeopathy, physiotherapy is one of the healthcare profession or a science. And here it is mainly concerned with the human functions, the movements, and the maximizing the physical potential. So we are mainly concerned with the range of movements, with what the human functions are, with what the daily activities of the patients are, and how I can maximize those physical activities. Okay, so this is what physiotherapy is usually dealing with. Then it is concerned with identifying and maximizing quality of life and movement potential within the spheres of promotion, prevention, treatment, intervention, rehabilitation, and rehabilitation. Now, what is habilitation, rehabilitation? Rehabilitation is when we are trying to restore the function of any particular part after any particular injury or after any particular condition comes to any patient. So our main target will be to identify and maximize the quality of life. Now, understand this term quality of life. This is very important for the physios. We are trying to improve the quality of life of the individuals, because maybe for example, if any person is having osteoarthritis, and he's in grade 3 or grade 4, and then the surgeon, he goes to an orthopedician, and the surgeon opts to operate it. Maybe a knee replacement is done. After the knee replacement, it is not necessary that the patient is hale and fine. For him to get back to his work is very important. The quality of life after the surgery is also very important. So that quality of life is being brought back or improved, maximized by the physios. Okay, we go further. Now, how we have different definitions for or terminologies like that. In physiotherapy also, there are different federations or associations or councils who give different definitions. This is one of the definition which is like the previous, given by the World Confederation of Physical Therapists, where physical therapy is concerned with identifying, maximizing quality of life and movement potential within the spheres of promotion and prevention, treatment or intervention, habilitation and rehabilitation. Just now we discussed about all these things. We'll go to the next definition. According to the Australian Physiotherapy Council, it says that physiotherapy involves the holistic approach to the prevention, diagnosis, therapeutic management of pain, disorders of movement, optimization of function to enhance the health, and welfare of the community from an individual or population perspective. So what we are doing is we are going in a holistic approach. Am I audible? Am I clear?
Yes, ma'am, it is clear.
I continue like this. Is it okay now?
Yes, ma'am.
Okay. So physiotherapy involves a holistic approach. What does that holistic approach means? Holistic approach means I have to first consider what are the complaints of the patient. After considering what are the complaints, I have to take the complete history, go for the complete assessment. And when I mean by assessment, it's not only that particular joint or that particular muscle, it's even the daily activities or the vocational means workplace assessment also, wherein I want the patient to get back to normal, to get back to his work in a normal way. So holistic approach means I have not only to treat the pain, I have to treat how he has to get back to his work, how I have to see that prevention is also being taken care so that he doesn't get the same symptoms again. So we have to go in a holistic manner to treat, to prevent, to diagnose the particular condition. In the same way, we have to manage the pain, disorder of movements, and then we have to optimize the function. That means we have to increase the function of the patient. Then we have to enhance the health and welfare of the community, of an individual or a population. So this is not only regarding any one individual, the population who are related with that particular individual also should be educated properly. For example, if I am treating a cerebral palsy child, then I need to tell the attenders or the caretakers or the whole family should take part in that particular treatment. Then only my treatment will be in a holistic approach and will be more better to get the results. Okay. Next definition. This is given by the Canadian Physiotherapy Association. The heart of physiotherapy profession is understanding how and why the movement and the function takes place. So I need to understand the anatomy and physiology properly. I need to know that if I have got a frozen shoulder patient, then the frozen shoulder is occurring at which joint, which are the muscles which are affected, whether they are stiff, whether they are tight, or whether they are lax, or whether they are weak, and then I have to treat the patient accordingly. Physiotherapy is anchored in movement sciences and aims to enhance or restore function of multiple body systems. So we have not to only take care of one particular joint or muscle, we have to take care of the surrounding tissues around it so that we see that the functions are restored properly. Okay. So these all give an outlook of what is physiotherapy. Mainly it is restoring the function, mainly it is promoting the daily activities, mainly it is making the patient get back to his work in a normal way or in a better way than the previous, and improve the quality of life. These are the main aims and objectives of what physiotherapy treatment is. Okay, we'll go further. Now, we have different specialities in most of the healthcare sciences. Like modern medicine has different specialities like maybe pediatrics, gynec, etc. In the same way, we have in Ayurveda, wherein we have KC, Panchakarma, Kaumaravitya, Prasuti, and etc. In the same way, physiotherapy also has different specialities. I'll just go through the specialities so that you know where all physiotherapy can deal with in different conditions, in different types of patients, so that further you all can go for integrative approaches. Okay, the first specialty is musculoskeletal or orthopedic condition. This specialty deals with most of the musculoskeletal diseases, may it be frozen shoulder, it may be cervical spondylosis or low back ache, it may be tennis elbow, Colles fracture, or conditions related to hip, knee, ankle, like osteoarthritis, rheumatoid arthritis, calcaneal spur, etc. So most of the musculoskeletal or the orthopedic conditions require physiotherapy to get back to normal. Then come the next specialty, that is the cardiopulmonary specialty. Now in cardiopulmonary specialty, we are dealing with the chest area as well as the lungs, respiratory functions. Post CAPG, post COPD, then bronchitis, bronchiectasis, asthma, all these conditions they require physiotherapy to certain extent. It may be either to increase the chest expansion or to increase the breathing, to increase the respiratory rate. All these conditions do require physiotherapy to certain extent. Next we have the neurological specialty. In neurological specialty, especially patients who are having GB syndrome, Parkinson's, Alzheimer's, of course, medicines do work for them to a certain extent, but getting that patient back to normal or improving the quality of life of that patient is physiotherapy is very important. For example, post-stroke, when a patient is having hemiplegia, the stroke part is taken care of with the medicines. But when we give exercises, when we are trying to rehabilitate the patient, that time the improvement is more better compared to only medicines. So always, especially here, we are going to we go for integrative approaches where hemiplegia, GB syndrome, Alzheimer's, Parkinson's, they are all being given physiotherapy along with Ayurveda treatment, and we have seen better results when the treatments have been integrated in both in these conditions. Then another specialty is pediatrics. Pediatrics is a specialty wherein it requires physiotherapy in conditions like cerebral palsy, CTED, then post fractures, etc. Cerebral palsy is one of the physiotherapy is one of the mainstay in cerebral palsy. The cerebral palsy is not a fatal condition. We all know the prognosis of cerebral palsy. The child has to undergo physiotherapy like as if he has to go to school every day. He has to undergo for physiotherapy every day, which maintains the quality of life, which maintains the movements or the stiffness and all is reduced. Otherwise, there will be worsening of the condition. Next very important specialty is the sports medicine. Now we all know sports have the major of the national, international teams have their own sports physios. Now what these physios do there is they maintain the fitness of the players. Now how do they maintain the fitness is they are responsible for the fitness during the sessions or during the sports, after the sports when the relaxation period is there, or when they have to get back to the sports so that they give their maximum. So how much activity or how much fitness should be done by that particular player during those particular sessions is being dealt by the sports physiotherapist. And mainly these things are required so that the sports injuries are reduced. Now, sports injuries are also taken care by physios, even maybe post-surgical if surgeries are required, or pre-surgical. For example, if grade 1 or grade 2 of sprains and strains are there, then surgeries are not usually recommended. That time physios play a very important role. So, in sports nowadays, which it is come up, it's booming everywhere, where sports medicine physiotherapists are coming up. Next, very important specialty is geriatrics, like the older age group. So the individuals above 55, 60 years are considered to be geriatrics. And many of us, because of our lifestyle, end up in geriatric age group having n number of conditions. May it be diabetes, may it be hypertension, may it be any other condition like asthma, COPD, or degenerative changes like osteoarthritis, rheumatoid arthritis. Now, all these major conditions, Parkinson's, Alzheimer's, do require physiotherapy so that the quality of life during that period is maintained or is betterment uh, done by the physios. Okay. Next important specialty is women's health, that is gynac or OBG. So let it be urinary incontinence, let it be prolapse uterus, let it be antenatal care and postnatal care. Women's health always require physiotherapy to be dealt with. Next important specialty is oncology, wherein cancer patients are dealt by physios. Let it be breast cancer, uterine cancer, or any other intestinal, abdominal, or any other esophageal cancer. The treatments of the cancer, they are having some side effects, maybe breathing problem, maybe swelling or edema, or lack of movements, bedridden patients. So these all patients require physiotherapy to a larger extent. Then coming to the community-based rehabilitation. What does community-based rehabilitation mean is like preventive and social medicine. It is like preventive and social medicine when compared to the modern one. Or we can consider Swasthavrita of the Ayurveda, wherein we are trying to prevent certain conditions to be accumulated by going into community, by educating a particular community, by giving group exercises, by giving them activities of daily living which will help them to be active and to which ensures that they are less bedridden or less unhealthy. Next specialty is the manual therapy. Now, when I'll be dealing with the further slides, wherein I'll tell you all about what all treatments are being done through physiotherapy, and I'll let you know about manual therapy also. This is one of the very important specialty which has come up nowadays in physio, which deals with treating of the patients without the help of any electrical modalities. Okay, so these are the specialities of physiotherapy, right from orthopedic to manual. Okay, next we'll go to the further slide. Now, as I told you, right from children, adults, adolescents, adults, elderly, we all require physiotherapy at some particular age group. It's not that only musculoskeletal are treated. It's not that only neurological. It's even the children like cerebral palsy, CTE, up to geriatric, let it be Parkinson's or any. All these conditions, physiotherapy helps a lot. Okay, now as we saw the specialities of physiotherapy, we will see the different types of therapies which are being done in physiotherapy. Okay, the first one is a hands-on or the manual therapy technique. As I told you, the manual therapy, wherein no electrical means is being used to treat the patient. Here, joint mobilization, joint manipulation. Yes, any questions? Here,
No, ma'am.
okay, I'll continue. Here, joint mobilization, joint manipulation, physiotherapy instrument mobilization, that is with the help of any instruments, but which are not electrically used, okay? Like M2T blades, taping, or any other technique like Voita's sensory integration kits, like that. These therapies are done. Then we have the minimum energy techniques, massage, like kneading, stroking, tapping, and soft tissue techniques like myofascial release, PRT, positional release therapy, wherein we give particular position to any particular patient for that pain to get minimized. So these all techniques are based on the condition, the severity of the condition, and which therapy should be utilized so that which condition we get better results. So these techniques we'll see in the next class wherein we will be discussing about the exercise therapy. Okay. Next one is taping. Okay, this is also one of the major skilled technique of physiotherapy, wherein we go for strapping or taping techniques. We use different types of tapes like kinesio tapes or supportive strappings, and the taping is done in order to assist any injury or for pain relief or to improve the function of the patient. Now, for example, I can give you a few example like um, CTEV. We all know congenital talipes equinovarus. Now, in CTEV, the taping is done in such a way that the talipes equinovarus is being everted. Okay. Then we have a frozen shoulder, wherein taping can be done so that the pain is relieved. Then we have strains or sprains, wherein grade 1 or grade 2 strains or sprains are there, so that taping can be done so that the pain is relieved and the immobilization is taking place at those particular points. Okay, so this technique mainly helps in preventing or in assisting the injuries or in pain relief. Okay, or it even helps in improving the range of motion. For example, post fractures, we can all after the rehabilitation when stiffness is reduced, we can use taping in some conditions. Okay, next technique is acupuncture or dry needling. Now, acupuncture or dry needling, this comes even in the naturopathy also. But here we have special courses wherein we can get training for acupuncture, wherein we have the acupuncture points and we have to stimulate them. And dry needling is without special types of small minor needles are available, which are being done at particular trigger points, and these help in relieving pain and improving the muscle function. Okay, this is also another type of technique which can be used for treating the patient. Next one, the exercise part. Now, in this exercise, of course, we will see it again in the next session, but I'll just briefly tell you what, because it is the part of physiotherapy. The use of exercise therapy is done to strengthen the muscles and to improve the functions. Now, it is not only to strengthen, we can use it for stretching, we can use it for relieving the stiffness, etc. Now, different types of exercises are available like stretching, muscle stretching, or core exercises wherein core strengthening can be done. Strengthening exercises wherein resistance can be applied with different types of things. Then neurodynamic exercises wherein neurological patients are more useful of it. Then balance exercises, proprioceptive exercises, and then Swiss ball, that is the Bobart ball exercises. Next, hydrotherapy. This is again one of the very effective method and important method for treating the patients, wherein water is used. Aquatic exercises are used so that we get improvement in the range of motion. We get improvement in the pain. That pain reduces, stiffness reduces, spasm reduces. So hydrotherapy is again a very important type of exercise. Next is sports. We already saw one is for managing the sports injuries. Sports physiotherapists to take part, and another is for pre-habilitation. That is for preparation of the sports. As I said, how much fitness is required during the sport, at the resting period, or when the sports is eventually about to come. So all these cases, sports physios play a very important role. Next, women's health, as we saw, antenatal care, postnatal care, and pelvic floor exercises. Then workplace physiotherapy or ergonomics. Okay, ergonomics is nothing that but wherein we are giving a particular activities or the activities of daily living which are done in a better way. Okay, now workplace physiotherapy is for example, I consider a patient who had stroke. After stroke, he had hemiplegia. Now he had paraparesis. He recovered with the help of the treatments. He is fit and fine to get back to his work. Now we have to consider that time how he will be able to get back to his work. Now some residual paraparesis might be there. For example, foot drop might be there, or patient is not, if he is a right-handed person and he had a right hemiplegia, he is not able to still take his pen and write properly. His handwriting is changed. So we have to give that particular part good training so that he gets back to his work. Then, for example, nowadays we have seen many IT professionals coming up with a lot of low backache, cervical pain, carpal tunnel syndrome, or osteoarthritis, hip arthritis. Now, these patients might come to us. They might take a treatment of maybe 1 month, 2 months, depending on the condition and the severity, and they are ready to get back to the work. Now, if we don't tell them what are the ergonomics to be followed at the workplace, then we fail to tell them how to prevent the another session of the same symptom to relapse. If I don't tell them, suppose a patient is there who is an IT professional, he has come to me for neck pain. Okay, I have treated him and his pain is come down to maybe 80% or 90%. Fine. Further, I will tell him to get back to his work. Once he gets back to his work, and if his ergonomics or the workplace is not monitored properly or not taken care of properly, maybe his sitting habit is not correct, maybe the chair and the table height is not correct. Okay, so if that thing is not taken care of, then there are a lot of chances of getting back or relapse of the same symptoms again. So in order to prevent that relapse of the symptom, we need to see that the workplace is correct. So my first advice before he gets back to work will be to see the height of the desktop, the table, and the chair. So I should advise him how to prevent that worsening of the condition. So workplace physiotherapy is a very, very, very important thing in nowadays, because our lifestyle is coming up with a lot of different conditions in different patients. Nowadays, even students or children who are school going come up with backache and all. That is because of maybe they are riding bicycle. The bicycles are having different types of. We are having different type of bicycle wherein bending forward is more or something like that. Nowadays, even the bags which they carry, the books which are being given, they are so much heavy that they are inducing low backache, or maybe the posture in which they are sitting, the desktop or the table and the chair which they are using is not appropriate. So we need to take care of all that and tell the patient which lifting techniques are there, or educate the patient about the workplace properly. So this is another important thing in physio. Next, coming to the electrotherapy, we will see each and every electrotherapy modality in detail in the further slides. These are some of the modalities, that is therapeutic ultrasound, TENS, electrical muscle stimulation, and many more will be there. Then, whenever any patient comes to us, it is very important that we go into the detail of the biomechanical assessment. It is one of the important assessment. We have to observe the posture, the gait. We have to observe the anatomy related to that particular joint, let it be shoulder, hip, knee, etc. Whatever. So once we have seen the biomechanically, analyze the patient, seen the gait of the patient, seen the activities, let it be if it is of upper limb, seen the activities of the patient, then doing the treatment protocol is a better option. Next. So, as sir wanted us to see some conditions and what are the treatments required. First and foremost, when a patient comes to me, the chief complaints for which the patient is come to us is very important. Once we see what is the chief complaint, we have to go into the detailed history. For example, let me take osteoarthritis. Uh, we have to go into the detailed history of when the pain comes, when it subsides, whether rest is increasing the pain or decreasing pain, whether early morning pain is increasing or decreasing, how much is the pain scoring on VAS scale. Okay, all these things are very important. Then detailed assessment of that particular joint, and one joint superior and inferior to that joint should be done, so that if any patient is having any other joint work, for example, osteoarthritis of knee may be connected with flat foot also. Okay, so we need to see in detail the one joint superior and inferior to the joint which we are treating. Then we need to plan the treatment. Now the plan of treatment will depend on the patient, the severity of the condition, and what complaints he wants to get cured first. For some patient, the pain is very important. For some patient, pain, getting down with the pain is very important. For some others, maybe range of motion or stiffness is very important to get cured first. So depending on what is the chief complaint and what are the concerns of the patient, we need to plan the treatment. Then treatment can be in three terms, maybe electrotherapy, wherein any electrical means we go on using any modality to get the appropriate results. Or another therapy is the exercise therapy, wherein we are giving particular group of exercise like uh, whatever it is, stretching or strengthening or relaxation like that, or manual therapy wherein we are using myofascial release or positional release therapy or M2T blades. Okay, so depending on the condition, severity, and what are the patients what are the patient's expectations, we need to plan the treatment. Fine. Next, now coming to the electrotherapy part. So we have few electrotherapy modalities which I will be discussing further in this further slides. Some of them are TENS, that is transcutaneous electrical nerve stimulation. Another is IFT, that is interferential therapy. Then we have the ultrasound, hot moist pack, shortwave diathermy, then the traction, cryotherapy, infrared radiation with ultraviolet radiation, wax bath therapy. These are the commonly used electrotherapy modalities since many years. Now, recently we have got many advances in physiotherapy, wherein matrix rhythm therapy is come up, shockwave diathermy is come up, then laser therapy is there, hydrotherapy, and combination therapy, wherein a combination of few therapies can be done. Okay, let us see in detail some of the therapies now. Okay, coming up to the TENS. Okay. Okay. TENS. This is also called as, this is a short form of transcutaneous electrical nerve stimulation. And here we are applying the low frequency current through the surface electrodes to obtain electroanalgesic effect. Now, what is electroanalgesic effect is wherein we are trying to obtain an analgesic effect, that is pain relieving through the electrical means. Okay, so it is an application of electrical stimulus with the help of low frequency current. Now, current is measured in terms of frequency. Okay, so we are applying low frequency current in TENS. There are other instruments wherein medium frequency or high frequency is used. Now in TENS we are using frequency which is less than 150 hertz. Okay. Now in this instrument, surface electrodes will be available. Okay, as you are seeing in this picture, these are the electrodes and these are the wires connecting to the instrument. Okay, so these electrodes will be applied at the particular joints for the desired. Okay, the effect and use of TENS depends upon gate control theory. Now we all know that gate control theory. What is gate control theory? Gate control theory is, we all know that there are particular pathways through which pain sensations are carried from the peripheral to the brain, and then once the brain gets that pain sensation, then our body will respond to it. For example, if I have osteoarthritis of the knee, then suddenly my brain is not going to understand that there is a degeneration and I have osteoarthritis. The pain should be moving through the pathways to the brain. Okay, that brain should get the stimuli that there is pain occurring at the knee. Then my body will respond to it. Okay, so those pathways are being cut down or broken down through TENS. Okay, so those pain sensations are not allowed to reach up to the brain or the spinal cord. That is how the effect of TENS works. Okay, that is how the effect of TENS works. Now, there is another theory wherein there is release of endorphins. Endorphins are the chemicals which are being released, which are the helping in the diminishing of the pain. So, this TENS also releases the endorphin, and thus, by the help of release of endorphin or the gate control theory, the pain is subsided. Next, there are different types of TENS. Okay, one is a high frequency TENS, the low frequency TENS, and the burst TENS. Now, what is high frequency TENS? When the frequency of the TENS is above 100 hertz. Okay, this is called as high frequency TENS. What is low frequency? When it is below 100 hertz. Okay, this is low frequency. And burst TENS is when the frequency is fluctuating, wherein it goes, increases, and it comes down. So depending on every manufacturing company of this product, there are different types of frequencies which are used. For example, which we have 22, 40, 60, 240, 80, and 120. So low frequency is 240, 80, and then high frequency is 120. Okay, so we have different types of frequencies. Then burst TENS will be wherein the frequency will be fluctuating between 2 to 120. So it will be 240, 80, and 120. Then again it will be 240, 80, and 120 during the treatment session. So depending on the condition, I can use high frequency or low frequency or burst TENS. Okay. Then it can be used used in the treatment of most of the musculoskeletal pain, obstetric pain, post-operative pain, and chronic pain. Okay. Any condition, let it be osteoarthritis, let it be rheumatoid arthritis, frozen shoulders, cervical spondylosis, low back ache, or any calcaneal spur, etc. All these conditions, major conditions, can be dealt with the help of TENS. Okay. In fact, we can consider TENS to be like a paracetamol or crocin in physio, wherein majority of conditions can be treated with TENS, right from application of 15 to 20 minutes up to 24 hours, we can use it for treating any patient. Okay, obstetric pain, for example, in case of labor, there are special TENS devices which are used in case of labor, wherein during the labor to ease the pain, labor pain, TENS is being given. It is safely being given. There is no contraindication. Okay, except few condition. Apart from that, post-operative pain like abdominal surgery or knee replacement or any other surgeries, we can very well go for the usage of TENS. Then chronic pain, okay, for example, oncology or cancerous pain, okay, post radiation or post chemotherapy or post surgery, TENS can be given. In fact, portable TENS machines are available wherein the electrodes are being applied at those particular parts, and that machine can be carried in the pocket, and this TENS can be given up to 24 hours. Okay, so right from 15 to 20 minutes up to 24 hours, we can safely apply TENS in all the conditions or majority of the conditions. There are some contraindications like demand type of pacemakers or hemorrhagic conditions, open wounds, carotid sinuses over the mouth or near the eyes. Okay, so these contraindications should be ruled out. And another important thing is the sensation should be intact in the patients who will be treated with TENS. Not only TENS, okay, all the electrotherapy modalities or the heating modalities, whenever we are applying on any patient, we have to see that the sensations are intact, because it's a patient feedback which is required during the application. When I apply the electrodes, when I apply these electrodes to the patient and I increase the frequency or the intensity, I will ask the patient whether the patient is feeling the tingling type of sensation during the therapy. If the patient doesn't have proper sensations, then his feedback will not be enough for me to treat the patient. So the sensation should be intact. Remember this point. The sensation should be intact during the treatment of the patient while giving any electrotherapy or heating therapy to the patients. Okay. Okay, getting to the next electrical modality. This is IFT. IFT is the nothing but the interferential therapy. Interferential therapy is where two currents are diagonally meeting each other and producing one current. Okay, and that one current is utilized for the treatment of the patient. Okay, now, okay. IoT is the application of two medium frequency currents. Now, in TENS, we use the low frequency currents. Here we have two medium frequency currents, and they both cross each other, or they both interfere each other at a point, and that produces a low frequency current. Now, the desired frequency in the usage of IFT is 1 to 250 hertz. So, somewhere ranging from 1 to 250 hertz, we can go for IFT. Okay, next, the major advantage of this is along with pain relief, there will be muscle stimulation. In TENS, we have main physiological effect or main advantages relief of pain. Here, along with pain relief, we have other physiological effects also, and those effects are muscle contraction along with mild sensory stimulation, increases circulation and reduces swelling. So we have a mild sensory stimulation also here. So, for example, in case of I can consider in case of uterine prolapse, or for example, in case of low back ache, wherein there is a lot of this spasm. Okay, we can osteoarthritis, wherein a lot of swelling is there. Instead of going for plain TENS, we can go for IFT. which will give us better results in one treatment only. Okay, so depending on the condition, depending on the severity, we can choose between TENS and IFT to treat the particular patient. Okay, if only pain relief is required, or especially if radiating pain relief is required, we can prefer TENS. Or if along with pain relief we require even muscle contraction, we require even sensory stimulation, we require improvement in metabolism and circulation, we require immense reduction in swelling and spasm, we can go for IFT. That would be a better choice. Okay. Next, the indications are relief, pain relieving, as we saw, muscle spasm relief, re-education of deeply situated muscles, then musculoskeletal conditions. So most of the musculoskeletal conditions are right from cervical, lumbar, from shoulder to hip, knee, ankle. We can use IFT again, but again we have to decide between IFT and TENS depending on the severity, depending on what outcome is required. Okay, so as I told before, if plain pain relief is required, then TENS would be a preferred better. And if along with pain relief we require some other things to be taken care of, like muscle spasms or stimulation of sensory things or something like that, then we can go for IFT also. Then there are again contraindications that also should be considered. For example, cardiac pacemakers, advanced cardiac diseases, recent hemorrhages, hypertension, hypotension, pregnancies, neoplasms, fever, infection. These all should be taken care of. They are contraindicated. So when these conditions are there, we can preferably go for TENS application, which would be more better. Okay, now why these conditions it is contraindicated is because it increases the metabolism and the infection of the, it increases the metabolism and the circulation. Because metabolism and circulation increases, these conditions will, there are of, there are chances that these conditions will be having a different side effects. So we need to see that they are contraindicated, and we need to rule out these conditions before treating the patients. Okay, next. Then next, these were the two electrical modalities which, when applied, give a tingling type of sensation, that is TENS and IFT. Okay, these were the two electrical modalities. Coming to the heating modalities, okay, there are many heating modalities also in physiotherapy. Now, what do they do? Heating therapies, they are also known as thermotherapy in physiotherapy. Now, what is thermotherapy is increase in the temperature so that we get a particular result. Okay, it consists of application of heat for the purpose of changing the cutaneous, intra-articular and core temperature of the soft tissues with the intention of improving the symptoms of certain conditions. So what we are doing in thermotherapy is we are applying heat for the purpose of changing the cutaneous, intra-articular and core temperature of the soft tissues. Why we are applying it? So that we change the temperature of the particular soft tissues or the intra-articular tissues, and that is to improve the condition of the patient. For example, what we do in Svedana, like PPS or Varicose Veda, anything, or Nadi Sveda, wherein we are trying to give increase in the heat so that we get a relief in pain, or we get release in the stiffness, or we improve the range of motion. In the same way, we are trying to use thermotherapy in physiotherapy. Next, thermotherapy, these are the use. Thermotherapy, they are useful agents for the treatment of musculoskeletal injuries and soft tissue injuries. So wherever musculoskeletal injuries are there, like frozen shoulder is there, wherein a lot of stiffness is there at the shoulder, particular shoulder, or when there is low back ache with a lot of spasm. Okay, that time for me applying thermotherapy is a very good adjunct of therapy. Okay, next, using heat as a therapeutic intervention decreases pain also. So because muscle spasm is released, pain will automatically decrease, because only spasmodic low back ache also are there. We have heard about it. Because stiffness at the shoulder is released, again pain will be reduced. Okay, because the movements will be improved. The patient is able to do more better daily activities, right? So, using heat as a therapeutic intervention, it decreases pain in the joints and muscles as well as soft tissue, and it has effects on the tissue metabolism, blood flow, inflammation, edema, and connective tissue extensibility. So, the tissue metabolism increases, there will be vasodilatation of the blood vessels, so blood flow increases. Once metabolism increases, edema and inflammation, they both come down. Okay, because we are applying thermal or heat, we are applying, the tissue extensibility increases. Okay, so the tissue gets relaxed and then extensibility increases. So
माझ्या झाल्या 5-6 चपात्या करून ठेवल्या, संध्याकाळच्या संध्याकाळी गरम करायच्या. आज
these all conditions we can go for in application of heat. Next, there are some of the heat. These are some of the heating modalities which are used in physio. The first one is a hot moist pack. Second one is a ultrasound, shortwave diathermy, laser, infrared radiations, ultraviolet radiations, and wax bath therapy. Now, let us see all these modalities during the therapies. Now, what happens? What is the purpose of application of heat? Okay, first, by increasing the heat temperature of the skin, the blood flow increases by causing vasodilatation. As we saw, vasodilatation will be there of the blood vessels. Okay, thus the metabolic rate and the tissue extensibility also increases. So, the metabolic rate, as we discussed earlier, that will also increase. Then heat increases the oxygen uptake and accelerates the tissue healing. It also increases the activity of destructive enzymes such as collagenase and increases the catabolic rate. Okay, so whatever destructive enzymes are there, its activity is increased. The collagenase and oxygen uptake accelerates the tissue healing. Okay, so these all are the purposes of the heating. Next, heating of superficial tissues can be achieved by using hot packs, wax baths, towels, heating towels, sunlight, saunas, heat wraps, steam baths, or steam rooms. Okay. Now, let us understand that heating can be done in two ways. Only of the superficial tissues, wherein up to the muscles, fascia, superficial fascia, muscles it reaches. The other heat is reaching up to the deeper level, that is deeper tissues like the bony tissues. Okay, so heating of the superficial tissues is required in a few particular conditions like where spasms are there. Okay, but deeper tissue heating will be required in wherein degenerative conditions, etc. Okay, so depending on which condition we are treating, we can choose the different modes of treatment. For example, we saw behind that we have a number of heating modalities, like let it be hot moist pack, ultrasound, short wave, laser, etc. Now, among these, if I have to categorize them into superficial and deeper heating, I would say that hot moist packs, infrared radiation, ultraviolet radiation, and wax bath therapy, these are the superficial heating modalities, wherein the heat reaches only up to the muscular level. If I want a deeper heating modality, then I can go for ultrasound, shortwave diathermy, laser, etc. Okay, so which condition we are treating and what is the physiological effect which we want, accordingly we have to choose the heating modality which are being shown here. We also get the heat in the deeper tissues. As I mentioned just now, deeper tissues up to the bony levels, we will get through the ultrasound, shock wave, or infrared, etc. Next, again in hydrotherapy, if we use warm water, okay, to exercise in warm water, then we will be using thermotherapy even in this way for the patients. Okay. Now the warmth of water, it blocks the nociception by acting on the thermal receptors, mechanoreceptors, thus influencing the spinal segmental mechanisms. Okay. So it can be used for the relief of pain for many patients and also neurological and musculoskeletal conditions. Right. This is how hydrotherapy. If we use warm water there also we can apply thermotherapy along with hydrotherapy, thermotherapy. Next, it also gives positive effects on cutaneous barrier homeostasis and anti-inflammatory activity. In addition, the warmth enhances the blood flow and causes muscle relaxation. The hydrostatic effect helps relieve pain by reducing peripheral edema and by dampening the sympathetic nervous system activity. Okay, these all changes we have already seen. But then there are certain physiological effects which are occurring due to the heating. Now, what are the physiological effects is it helps to lessen the nerve sensitivity. So, whatever nerve sensation is increased or decreased or altered, it helps in lessening that nerve sensitivity. It increases the blood flow. We all know vasodilatation occurs. It increases the tissue metabolism. So, metabolism of that particular area increases. Thus, it decreases the muscle spindle sensitivity to stretch. It causes muscle relaxation. It increases the flexibility. Once muscle relaxation occurs, automatically the flexibility and extensibility of the muscle increases, right? Then it stimulates the cutaneous thermoreceptors that are connected to the cutaneous blood vessels, causing the release of bradykinin, which releases the smooth muscle walls, resulting in vasodilation. How vasodilation occurs? This is okay. Next physiological effect is muscle relaxation occurs as a result of decreased firing rate of the gamma efferents, thus lowering the threshold of the muscle spindle and increasing the efferent activity. This is all the physiology part. Okay. Then there is also decrease in the firing of the alpha motor neuron to the extrafusal muscle fiber, resulting in muscle relaxation and decrease in the muscle tone. Now, we all know that there is every muscle has a tone, that is a normal tone. Now, this tone increases or decreases, which is called as hypertonicity or spasticity, and decreases, that is hypotonicity or flaccidity. Now, in these conditions also we can go for thermotherapy, wherein spasticity or rigidity can be reduced with the help of prolonged application of thermal therapy. Okay, so that can also be done. Then again, a very important precaution which should be taken is the skin sensation should be normal. So every therapy which we give in the patient in physiotherapy, may it be electrotherapy or may it be thermotherapy or may it be any other therapies, we need to see that the sensations are normal. Okay. Next important modality in physiotherapy is the traction. Okay, traction is a process of applying a stretching force to the vertebrae through the body weight or through weights or through pulleys or to distract the individual joints of the spine. Okay, so this is how traction is should be done. Okay, so we are trying to distract. What is traction is we are trying to distract the two joints. Let it be lumbar joints, let it be cervical, lumbar intervertebral joints at the lumbar or at cervical or at the SI. Okay, so we are trying to apply either body weight or different weights. Okay, and then we are trying to distract the individual joints so that whatever compression has occurred at that particular level is being released. Right? There are different types again in traction. One is continuous or bed traction. Continuous or bed traction we all have seen near many of the orthopedicians, wherein they are patient is made to lie down on the bed and then sandbag or some or other weights are being put and applied, and then the lower being are being distracted. Now this this is very time accumulating. Here minimum weight should be used. Like for example, maybe 6 kgs or 7 kgs, and then it should be given for a long duration. Okay, so this type of traction is having the disadvantage that the patient has to lie down on the bed for a longer duration, maybe 7 to 8 hours or 6 to 8 hours per day. Okay, the other means of traction are static traction or intermittent traction or manual traction or positional traction. Static traction or intermittent traction, they can be applied through the help of a traction machine. Okay, wherein traction is applied depending on the body weight. The weight of the traction is chosen or calculated, and then the patient is made to lie down, and be given for a minimum period, like maybe 20 to 30 minutes per day or 15 to 30 minutes per day or twice daily. Okay, so this will again help in. The advantage of this is we get a better results in a shorter duration. The disadvantage of continuous and bed traction is where these are used where traction beds are not available on the normal bed, and here the disadvantage is the patient has to lie down for a longer duration. Okay, which is not very convenient for the patient. Okay, so these are the differences. Next, we have manual traction. Okay, if anybody doesn't have the weights or doesn't have the traction bed or the traction machine, manually with the help of the therapist, we can apply the traction to the particular part which has to be treated. Positional traction. For example, I take gravity as a force, and then I do head down position and give traction for some part of my body. Okay, so like that positional traction, or there are different techniques wherein positional traction can be done for the particular patients. Okay, next, after traction, cryotherapy. This is again another important therapies which we do. The therapeutic use of local cold application for the treatment of various disease and disorders is known as cryo. This is often termed as hypothermy, like how we term thermotherapy for increasing the temperature. This is called as hypothermy, wherein the temperature is decreased of that particular joint or part which is treated. Then the physiological effects are again, of course, reduce in body temperature, reduction in the blood supply, and reduction in metabolism. So here we have reduction or vasoconstriction, reduction in temperature, vasoconstriction of that particular part which we are treating, and thus reduction in metabolism. Now this is used for relief of pain, again relief of muscle spasm, relief of swelling, inflammation, connective tissue extensibility, trauma, muscle tone is reduced, muscle strength is improved because of all these changes, endurance of that particular part is improved. Okay, it is indicated in the treatment of acute musculoskeletal injuries to reduce pain, to reduce spasticity, for relief of muscle spasm, etc. So most of the musculoskeletal injuries, like sports injuries, immediately cryotherapy is being given. Then we have other condition wherein sprains are there, strains are there. We can go for cryotherapy. Then if there is a lot of spasticity, so we can give cryotherapy in a prolonged way also for spasticity. Then if there is a flaccidity, we can give cryotherapy in strokes, okay, so that we stimulate the motor activity. Okay, so we can give cryotherapy for different conditions again here. The contraindications of peripheral vascular disease like Berger's disease, Raynaud's disease, then if we have a lot of varicosities, and those particular parts we are not allowed to give cryotherapy. Okay, this is one of the contraindications. Vapocoolant sprays. We get sprays which are available in the market. Okay, vapocoolant sprays. Then ice cube massage can be done. Cold packs. Okay, like packs are available here. If you have seen in this picture, These are the packs which are available easily in the market. Then the ice packs, ice towels. Ice towels are wherein we try to, we take water in a bucket or tub, we put ice cubes into it, and we dip the towel, Turkish towel, rinse it, and then apply it on that particular part. So these are called as ice towels. Cold immersions. So in the same way, wherein we take a tub, we put cold water, or we use ice cubes along with water, and then we dip a part. It can be done for the peripheral extremities only, like the wrist or the ankle. Okay, compressive cryotherapy or chemical cold packs. These are also again easily available in the market. Okay, coming to the advances, like as I said, these were the basic up to cryotherapy. These were the basic modalities which we are using. There are some advances which have come up. The first one is a combination therapy. Like there are instruments wherein they are having combination of two simultaneous therapies which are applied at the same time. Okay, they are for the better results. Okay, like for example, ultrasound and IFT can be done through the combination therapy, or ultrasound and TENS can be done at a particular time. Hot moist pack and TENS can be done. Okay, so like that, different type of combinations are being applied. They are being practiced nowadays, and they give different type of results and better results. Another important therapy is laser, that is light amplification by the stimulated emission of radiation. So laser, we all know laser radiations are there. These radiations are used in particular conditions, especially musculoskeletal conditions like myositis, fibrositis, tennis elbow, or diabetic wound healing. Okay, so it has majorly healing of the particular tissues of calcaneus, pulse, etc. Okay, so the therapeutic laser is used. Next is the shock wave therapy. Okay, here acoustic waves generated by the shock wave trigger biological effects which lead to the faster and long-term healing and regeneration of the tissue through shock wave. It covers a wide range of musculoskeletal conditions as a indications. Again, most of the musculoskeletal conditions can be used. Yes.
Hello, ma'am.
Yes.
Ma'am, is it audible, ma'am?
Yes, I am. Yes, it is audible.
Yes.
Any question?
No, ma'am.
Okay, I'll continue. Right?
Discuss in last, ma'am.
Okay, fine, no problem. Okay, shock wave therapy again is another modality which can be used for better regeneration and faster healing. Okay. Next is the matrix rhythm therapy. Now this is coming up very fastly booming up in physiotherapy, wherein which is acting at the cellular level of the tissues, and based on the vibratory behavior of the skeletal musculature and its characteristic frequency and amplitude spectrum. It is giving the therapeutic effect of pain relief, increase in the muscle activity, spindle activity. It helps in decreasing the swelling, decreasing the stiffness, etc. Okay, so this is another important therapy which is coming up. Okay. These are the these are the newly advanced techniques or the technologies, modalities which are coming up in physio. Okay, so this is what I thought of sharing with you all today, wherein I have told you about the what is physiotherapy, what are the important terminologies in physiotherapy which we are using, and what are the specialities. Many of us don't know that physiotherapy can be used in these areas also. Maybe some knew only up to musculoskeletal conditions. We didn't know that it is there in chest physio. We didn't know it is there in gynac or in oncology, etc. So these are the different specialities of physiotherapy. Then the electrical modalities. it is very vast actually. Electrotherapy is very vast. I tried to minimize and briefly explain every modality so that you know at least the basic of it. Okay, then the recent advances which were there in physio, like at present, which are coming up in physio, that is what I have tried to highlight in electrotherapy, especially. Um, I think I'm clear, and many of you have understood what I wanted to explain.
Thank you, ma'am. Thank you so much, ma'am. It was a very knowledgeable session, ma'am. Ma'am, some questions are there. Shall we discuss, ma'am?
Yes, 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 please.
First question from Dr. Rajiv. What is the role of physiotherapy in rheumatoid arthritis?
Okay. Rheumatoid arthritis is a condition wherein multiple joints are affected. Basically, pain will be there and stiffness will be there. Now, for pain, we can go for pain relieving modalities, maybe TENS, maybe ultrasound, etc. And we have to give general mobility exercises so that we see that the range of motion of all the joints are being not hampered. We have to maintain the range of motion. Suppose we don't give general mobility exercises wherein range of motion is not maintained, they slowly start going into deformities. That is how their daily activities are hampered, daily living activities. Maybe they are not able to eat, or we know that interphalangeal joints are affected very much in RA. So eating is a problem, cooking is a problem for females, or some other small activities which are being done by the hand, it gets problematic. So basically, pain relief is done. Reduction in swelling can be done with the help of. We use cryotherapy in most of the condition, most of the cases of RA. But because we are in our hospital, Ayurvedic hospital, we do integrative approach, and we go for Varuka Sweda or something where it's Vedana therapy is done. So for me here, I don't use cryotherapy. I use basically pain relieving, which may be done by TENS or something, or IFT, depending on the condition and severity, and then exercises. Exercise is the mainstream for rheumatoid arthritis to maintain the range of motion.
Okay, ma'am. Thank you, ma'am. Another question from Ajay Kumar Acharya. Whether cryotherapy is given in muscle stiffness condition?
Yes, cryotherapy can be given in muscle stiffness condition. It helps in releasing the stiffness.
Okay, ma'am. Thank you, ma'am. Next question from Lokesh. How can we deal with cerebral palsy and muscular dystrophy in children?
Yeah, as I mentioned earlier, cerebral palsy is not fatal. We all know the prognosis of it. Okay, the child has to live with whatever disability he has. So, in order to give a better quality of life, we have to go for physiotherapy on a daily basis. Okay, here we have children who come on a daily basis also, and plus we have children who come for 3 monthly visit or 6 monthly visit, wherein they go for integrative approach of Panchakarma and physiotherapy. Now in Panchakarma, maybe Shastika Shali is done, or Abhyanga is done, whatever, or Svedana therapies are given. After that, there is a lot of loosening of the muscles. Once that loosening is done of the muscles, when we go for exercises, the stretching or the improvement in the range of motion is more better. So both together we go for therapies. Then we teach the parents of the children what home program has to be done. Like many are from Belgium, but those who are not localized, who have to come from outstation, for them we teach what has to be done. Then again a home program is given for maybe a month or two, and follow-ups are done. So basically, physiotherapy is very important in these children to maintain the quality of life, to maintain the range of motion of that particular joint, or to what to say, to see that the condition is not worsened further. If a child doesn't go physiotherapy, if the stretching of the muscles is not done, for example, TA, in a diaplegic patient, the adductors are tight, the hamstrings are tight, the tendo HLS is tight. If that patient is not undergoing stretching on a daily basis, then they will be cross seizuring gait and all, which is not good. Okay, so we can prevent the worsening of the condition with the help of physiotherapy.
Thank you, ma'am. Next question from Ajay Kumar. Any significant result of physiotherapy in Parkinson's disease?
Yes, in Parkinson's, it is a slowly deteriorating condition. Okay, we all know they have involuntary movements, they have tremors in the hands, extremities, they have a balance problem. So we have to give them particular activities which help them to overcome these. For example, for tremors, we can give weight cups. Okay, we can apply resistance to those parts which are having tremors, upper extremities especially. Then for balance training, we can ask them to go for walk, to go for sand walking, to go for obstacle crossing, the lower limb exercise like ball kicking. Okay, all these things can be done so that again this Parkinson's is a condition which goes slowly deteriorating. So we can prolong the deterioration to some extent if the patient is following these conditions, these exercises. Another important problem in Parkinson's will be the breathing. Okay, so we can stop the weakening of the respiratory function muscles by giving them spirometry or deep breathing exercises, diaphragmatic exercises. Okay, so we can take care so that the quality of life and it is not fatal condition. The patients will not die because of Parkinson's, but the activities of daily living will be slowly hampered as and how time goes. So that thing we have to take care. Okay.
Thank you, ma'am. Now I request Dr. Supriya ma'am for vote of thanks.
I hope the session was fruitful and the knowledge was imbibed by the students.
Yes, ma'am. Yes, ma'am. Myself, Dr. Supriya Guddar, Assistant Professor, SVMC. So today on the 5th day of our webinar series, Panchajanya 2020. So we had a very enlightening speech by Dr. Deepti Bagewadi, ma'am. So we are very thankful, ma'am. And you have presented very nicely about hydrotherapy, acupuncture, dry needling, and traction. So it was a very innovative talk by you, ma'am. So I would like to say a hearty vote of thanks to today's talented speaker, Dr. Deepti Bagewadi, ma'am. And I'm very grateful to you, ma'am, on behalf of myself, Dr. K.C. Das sir, and all the of teaching staff members of SVMC Ilkal. And I also thank our committee members of Vijay Mantesh Vidyavartaka Sangha Ilkal for their constant support in organizing the webinar. And I also thank all the participants of this webinar for making successful. Thank you once again, ma'am.
Thank you. Thank you so much for giving me this opportunity.
Shall we end the session, ma'am?
Yes, yes. Thank you so much.
Yes, ma'am. Thank you, ma'am.